Yes.
Do we have Jamie McGarvey? Okay, Scott Robertson,
I'm here.
Dan Rabita,
Yes, I'm here.
Marianne Stickman,
Yes.
and we have regrets from Tanya Braybrush. Okay, so we'll start the meeting with the board chair, Nancy Drago.
Good evening, everyone. I'll be starting this Pepper meeting because we have an election, just so people know. So we have a call to order. And our first point of business is the election of a chairperson and a vice chairperson. And I have a recommendation here moved by Dean and seconded by myself. Be it resolved that Scott Robertson be elected chairperson of the Personnel Policy Labor Employee Relations Committee for the year 2001. Is there any discussion? Are there any other nominations from the floor? Okay, well, with that, since I hear none, I'm going to call a vote on this. So, Dean?
In favor.
Okay. Dave?
Yes.
Blair, are you on yet? Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Okay. Jamie, are you on yet? I guess Scott, I guess I could ask you to. I should have asked you if you accepted the nomination, first of all. So I guess if you say yes, you did.
Thank you for the nomination, and yes, I agree. Thank you.
Okay, thank you. I should have asked you that in the beginning. Dan?
Yes, it's a very good choice. Thank you.
Okay, I agree. Marianne, are you on there?
Yes, absolutely. 100%. Yes.
Okay. And then we have our Tanya, who's given her regret. So with that, it's carried. And with that, I am going to turn the meeting over to you, Scott, at this point in time. You've got the the vice chair position to do next. So it's in your hands now, Scott.
Thanks, Nancy.
Congratulations,
Appreciate
by
that.
the way. Congratulations.
Thanks to the members of the board. Should be a pretty quick meeting tonight. We'll see. Let's see, what do we got here? We went through that motion. The next one, as Nancy said, is for election of the vice chairperson. And there is a motion on the floor moved by Dave and seconded by Gary that Marianne Strickland be elected vice chairperson of the Personnel Policy Labor and Employee Relations Committee for the year 2021. I guess I'll go to Marianne. Marianne, do you accept the nomination?
I think she's muted.
She's muted.
I think she's frozen, actually. Marianne, if you can hear us, I think you're frozen. You might need to unmute, turn your camera on and off. Usually works for me. Should we, what do you think, Sherry, should we go on with the vote?
Why don't we proceed subject to her confirmation?
Right. Sherry, we're okay with that, right?
Yeah.
So we will just go to the vote then, with Marianne as someone who's being nominated. Is there anybody else? Are there any other nominations? I should ask. No other nominations. So we'll go to the vote. I'm going to pull up my trusty list of members. Dean.
In favor.
Dave.
In favor.
Blair, I don't think is in yet, but there's someone trying to get in right now. Is it someone on staff see that? There's someone saying who wants to be admitted. It's like a church.
No, I've declined them.
Oh, okay. I wasn't sure if maybe that was Blair with using a different device or something. Okay, so we'll move past Blair. We'll go to Gary.
Yes, approved. Yes.
Nancy.
Yes, approved.
Stuart.
Yes.
Jamie.
Yes.
Not here. Oh, Jamie's here now. All right. Thank you, Jamie. Let's see, we'll go to myself. I agree. Dan Revita.
Absolutely.
Marianne, are you with us? Oh, there's Marianne now, right? How's it going, Marianne? We were just talking about you.
And I faded into the background.
We kind of assumed that you accepted the nomination. Is that all right? Yeah.
That's fine.
And you support the motion, obviously?
Yes, thank you, everyone. It'd be my pleasure. And you show
So it
up
was-
every meeting, Scott.
It's carried unanimously, so you have the support of the committee.
Thank you very much.
Okay, so with that said, we'll move on to our business for tonight. We're going to approve the agenda. People had a chance to see the agenda. It's just, I think, one item on the agenda tonight. We've got a motion moved by Stuart, seconded by Jamie, that the agenda be approved. So I'll go to the vote. Dean,
Yes.
Dave,
Yes.
Blair, not here. Gary,
Yes.
Nancy,
Yes?
Stuart,
Yes.
Jamie,
Yes.
I agree. Dan Revita,
Yes.
Marianne,
Yes,
that's it. So we'll move on to our business tonight. Let's see here. Oh, so we have to approve the minutes from the last meeting, which was October 15th, 2020. So more than a year ago. I think there was just one item on the agenda that night as well. And there is a motion to approve the minutes from October 15th. That's moved by Nancy, seconded by Dean. Any comments about the minutes from October 15th, 2020? Seeing none, I'll go to the vote. Dean,
Approve?
Dave,
Yes.
Gary,
Yes.
Nancy,
Yes?
Stuart,
Yes.
Jamie,
Yes.
I agree. Dan
Yes.
Revita,
Oui, monsieur.
Marianne.
yes,
Okay, so we've approved the minutes from that meeting, moving right along. Also the in-camera minutes from October 15th. So any comments on those? Seeing none. It is, whoa, I just lost it. It is moved by Gary, seconded by Dave, that the in-camera minutes for the meeting held on October 15th be approved, 2020. So we've got Dean,
Yes, sir.
Dave,
Yes.
Gary,
Yes.
Nancy,
Yes?
Stuart,
Yes.
Jamie,
Yes.
I agree. Dan,
Yes.
Marianne.
yes.
All right. Well, let's see now. Here we go. This is where we get into the fun stuff. So we have a couple of collective agreements that are expiring this coming March. We're going to need to put people on our negotiating committees. I think the staff is going to report back to us in February, but I'll pass it over to Jose to discuss what's going on tonight.
Hi, everyone. So this will be a brief meeting, I think. Although this is our first Pepper meeting this year, it's certainly not because we haven't been busy this year. It has been busy for our staff, but I just wanted to get things started related to our negotiations coming up in 2022. So as Scott mentioned, we've got 2 collective agreements expiring at the end of March 2022. And one of the things we need to do is have a board representative on each of those negotiating committees. And if you look at the briefing note, it is expected that, it's hard to estimate how many days of negotiations we'll need, but I would estimate probably 3 to 4 for each group. Potentially starting in April, maybe in June, and then potentially into the fall. It really depends on how busy we are with the clinics in between January and March. So, and then I did provide a bit of information, some history, but for tonight, I really didn't want to talk too much about the financial implications. We'll be doing that in February, where I'll be providing you with some data. So does anybody have any questions about the time commitment? Or anything else?
Feel free just to turn or unmute your mics and jump in, anybody.
Are these going to be Zoom or are they in-person meetings? Do you know?
So the last round we did 2 years ago, we did do it on Teams, all of it, and it went very well. We exchanged, everything was sent back and forth electronically. So I expect we probably will be in the same situation next year. It really depends on when we do it, but it's likely that we will.
Any other questions from members of the committee? Comments? Okay, seeing none, I guess that's it, Jose. Anything else you want to add, Jose?
No, nothing. I have nothing else to add. And I think too, the ask is to have one person and then have another person designated as backup if something happens and the person's not available. And I know it seems a bit early to be talking about this, but sometimes we need to know who the rep is in order for us to start scheduling dates potentially in March or April.
Well, we happen to have somebody on our committee here who has got a lot of experience with this and a lot of knowledge of the organization. Don't know, Nancy, if you are interested in taking on this task. I'll put it over to you, though, Nancy.
Jose had spoken to me about it, and I said I would certainly agree, but I also wanted to put it forward. If there was someone who really wanted the experience, I didn't want to stand in their way neither. I've done, I think this would be number 4 time around. But, if someone has a real big interest in it, I have no problem stepping back if they want to do it.
I'm happy to serve as a backup. I'm interested in it a little bit, but I think I'd like to see you do it, Nancy, personally. I don't know, is there anybody else, committee members, who are interested in getting involved in this?
Stuart here, and I think you're a very good choice, Nancy, and Scott, you as well as backup. Thanks.
Thanks, Stuart.
I had heard Gary ask a question, so I just don't want him to not feel that he's not somebody who might want to do it too. I just want to be fair all the way around to everyone.
No, it's okay. I'm okay with Nancy and Blair, actually. Or sorry, Stuart.
Stuart.
All right, I have no problem.
Okay, so Stuart, I don't know if you're interested in doing it, Stuart. I'm happy to let you get in there too.
No, thanks, Scott.
No,
Entirely
okay.
good for you. Thanks.
So unless there are any other nominations for people to sit for this, or anybody else who wants to speak up, I think the motion is we're gonna insert Nancy and Scott as backup if needed into the motion. Any other comments, questions on that before we move to the vote? Keeping in mind that we're going to hear more about this in February. Okay, so we'll go ahead and put Nancy as our rep and myself as a backup, and I'll call the vote for that resolution. So Dean?
Yes, sir.
Dave?
Yes.
Blair? I think Blair's here now.
Yes.
Gary?
Yes, absolutely.
Nancy?
Sure, yes.
Stuart?
Yes.
Jamie? I didn't hear Jamie. Oh, I see him saying yes, though. Yep.
Yeah.
Okay.
Sorry.
I agree as well. Dan Revita?
Yes.
Mary Ann?
Absolutely, yes.
Okay, so we have our rep. Just given our direction on that matter. That's it, right? I'm pretty sure we don't need a motion for adjournment. That was all the business we had. Sherry, are we good now to move to the Board of Health meeting?
Yes, we are. Thank you.
Okay, I'll turn it over to the chair, Nancy.
Thank you very much, everyone, and welcome to our 24th of November meeting. We have a call to order. Oops, I'm just going to get everybody on the camera so I can see you. So first, a piece of business is approval of the agenda. And I have a motion here that has been duly moved by Gary and seconded by Dean Backer. Be it resolved that the Board of Health agenda dated November 24th, 2021 be approved. Is there any discussion on that? If not, we can call a vote. Dean?
Approve?
Dave?
Yes.
Blair, are you on yet?
Yes, I am,
Oh, you're good.
and I'm in
great.
favor.
Okay, welcome, Blair. Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes, yes.
Dan?
Yes.
Marianne?
Yes.
All right, with that, it's carried. Thank you very much. The next item we have, I'm just gonna move over here to we have a, motion here, moved by Jamie McGarvey and seconded by Dave Buttai. Be it resolved that the minutes from the Board of the Health meeting held on October 27th, 2021 be approved as presented. When I ask that, I'm going to just give it for discussion, or if anyone had any amendments or anything that were required from those minutes. Hearing none, then I'll call it to a vote. Dean?
Yes.
Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
And Marianne?
Yes.
And with that, it's carried. Okay, we'll go on to the next. Okay. Again, we have number 3 in the agenda is our conflict of interest. If there's anything in this agenda that people feel that they're in have a conflict of interest, please raise it at the time. Number 4, we already went approval of the previous minutes. I kind of jumped over. That when I saw that motion. Sorry, guys, we're ahead of ourselves. Number 5 is the date of the next meeting, which is January the 26th, 2022, and the time and the place is to be determined. Okay, and then number 6 says we have business arising. We have personnel COVID-19 immunization policy. Was there any discussion on that, or the only thing I just again applaud the board members for stating that the policy also refers to them, and I saw that Sherry made the changes in the policy and it was included in the package. So thank you very much for that motion and for that change to the policy. Number 7 is the report of the Medical Officer of Health. Dr. Chirico, it's yours.
Oh, thank you very much, Nancy. Everybody can hear me, I hope. First of all, I just want to start off by saying that Andrea McClellan, who was, she was in retirement last year and kindly consented to come out of retirement to lead the immunization strategy. Andrea will be retiring in a few days. She'll still be involved with the health unit because that's just who she is. But we owe her, and our communities owe her, a huge debt of gratitude for all the work that she has done behind the scenes. Nobody knows that isn't part of the health unit really how much is involved, how difficult it is, and what she has done has been truly amazing. She has literally saved lives. So just want to acknowledge that with her tremendous work that she's done. She's actually going to continue on as a little bit of a consultative role, but also she's going to be doing immunizations because she loves it. So we have a very big thanks to Andrea. So as far as the moving on to sort of the update. There's a more detailed update that you have now that I sent out. I can say that while we still have very low rates within our district, we do anticipate that they are going to increase. There are significant increases all around us. And now Temiskaming has put out letters of instructions to help curb their increase in the number of cases that they're certainly seeing. There's no reason to think that we are any different, and that this is why we are continuing to urge people to become vaccinated, to help reduce the spread among our communities by following public health measures. And simply because there are within legal limits to do gatherings and larger gatherings, it doesn't mean that it may be in your best interest to do so. So we're asking people to do a personal risk assessment of your own health, as well as those that are around you, and whether or not that it poses a significant risk, and whether or not you're vaccinated. As well, where you might be going. Consider the size of the groups that you may be encountering, and whether or not you know if they're vaccinated or not. And I think that coming up to the holiday season as well, that this all needs to be kept in mind. So we do anticipate increasing cases. Currently, we're doing extremely well, and we hope that we don't have to institute any restrictive measures and moving forward. The other thing I wanted to bring up is that, as may be well known to many of you, that the 5 to 11-year-olds vaccine has been approved by Health Canada and National Advisory Committee on Immunizations, and that today we are in receipt of the vaccines, and we will be starting administration tomorrow. We've put on, we're continuing with the clinics that we've had before for all the eligible groups, first, second, and third doses, as well as we're going to have special clinics over the next couple of weeks, specifically for the 5 to 11-year-olds, and that are kid-friendly and parent-friendly. And we have 2 clinics coming up on the weekend, and both of them are now full. There's a very tremendous uptake, and we're really pleased to see that. But don't worry that we will be adjusting our clinics depending on the need, and increasing booking appointments, as well as increasing clinics as capacity will allow, and continue to move forward to get all those that want to get vaccinated to be vaccinated. We've reached out to many different venues. Pharmacies have been tremendous. The primary care physicians and nurse practitioners, working with them. We're working with the school boards. We're going to be having clinics in the schools after hours, so the parents can be with their kids, and we're adapting to that. And potentially, certainly, we're going to be having clinics like this weekend to and cover the entire district. There's one in North Bay. There will be one in Parry Sound initially to start with. So there's lots of activity for that. We're also anticipating that as there's increasing demand, we get more kids and more people in the community vaccinated, that's going to help to lower community spread, and that's going to help us keep our schools open, so there's not outbreaks within schools. So there's lots of benefits to getting as many people vaccinated, including that age cohort as well. Studies are underway for those that don't know, from 4 years and under to 6 months, that there are studies underway. They don't anticipate sort of the application till the new year by the drug companies, but that would be the next step. But we don't have much information at all on that. So that's just a brief summary, and I'd be happy to see if anybody has any questions that I might be able to answer.
So, Chair, can I go ahead? Or I'm not sure if you're
Yes,
on me,
yes,
Nancy.
please. Yes, please, go ahead.
Okay. I'll have to be honest, I've been a little bit derelict with following the press conferences lately. I'm just wondering if there's any different trends or what you can tell us about the amount of people being hospitalized, what percentage of them are unvaccinated? Are you able to talk about that, or what's going on with that lately?
Yeah, currently we have, there are no hospitalizations. What we have experienced is that when we do have hospitalized patients, the vast majority are those that are unvaccinated or only partially vaccinated. What we have found since June 1st is that less than 4% of the fully vaccinated end up in the hospital, and less than 1% of fully vaccinated end up in the ICU. That's within our district. So and from the outbreaks that we've had, we have not had any serious illness, and that's in a population that's most vulnerable. And that we know that there's no question in my mind that the vaccinations have helped reduce severity of illness and hospitalizations and deaths. And this is really an amazing accomplishment, given that this is against the Delta variant, which is much more highly transmissible as well. So that's kind of where we are. Scott, does that help answer your question?
Yep, thanks. I was just having a conversation with someone the other day, and I have millions of conversations, and I sometimes wonder where people are getting their information or where the information is coming from. But it was about waning immunity, and the person was saying that more and more people who are vaccinated are getting seriously ill. But the trend lines aren't showing that.
No, I mean, we've been very transparent about the data, and nobody's hiding anything. And a lot of people are just very misinformed. And there's also a small percentage that want to propagate misinformation to their own ends. And people need to go to credible sources. You can start with our Health Unit site. There's lots of other sites that we list with credible information from credible sources. And there is no secondary gain on our part for this. And so we want people to have the truth, the information that is accurate. And there's absolutely no doubt in my mind that these vaccines are working. There's no doubt that the majority that end up in hospital are ill or dying, they're unvaccinated or only partially vaccinated. Does it happen to some that are fully vaccinated? Absolutely it does. Nothing is 100%, and it can occur, but it's all a risk. You do a risk assessment, and you're far better off if you are vaccinated, and especially if you are vulnerable. So waning immunity does occur. It's more likely to occur in those that are elderly or immunocompromised, and that is why we have gone to the booster doses to help with that. But what we did find, which in the outbreak that we did have, and it's a small number, but what we did find is that the 2 doses were very protective, and we had just gotten the 3rd doses into the retirement home people, and hadn't taken effect yet, and yet we didn't see any severe disease at all. The 2 doses really helped. So if we hope that people will go to the credible sources to get the accurate information and not just believe what's being said on social media.
Thanks a lot. Appreciate that. Thanks, Chair.
Does anyone else have any questions? Dr. Chirico?
Stuart here. I have a question, if I may.
Sure, Stuart. Go ahead.
Dr. Chirico, we talk provincially and then regionally within the province, but is there anything going on in Temiskaming, Quebec across Highway 63 much at all or not? Thank you.
I can't speak to that, Stuart. I'm sorry. I don't know for sure.
Okay, thanks.
Any other questions? I have one comment. I really, I'd like to bring this to the board. I'm wondering if the board would approve to send a letter to Andrea from this board, thanking her for all of her work. I've worked with her during this COVID. I've been vaccinating, and she's there, and it comes in and out as we need her, and she's really put her heart and soul in doing this. And as of all of you have probably experienced, those clinics have run very well, and the community just raves about it. So I really would, I'm wondering if you would agree to that the board sent her a letter thanking her for all of her hard work.
Yes.
Yes, please.
Okay, well then we will.
Thank you, Nancy.
Yeah, because I think that's really important. And as Dr. Chirko said, her work has saved lives in this community, and she's a part of this history of this community for doing what she did. So thank you very much to the board. So we'll drop that up, and we'll have you take a look at it. And if there's any other comments you want to add, then we'll send it out to Andrea. Thank you very much. All right. If there are no other questions, we have our board committee report, and that was just the one we just held a couple minutes ago. So 8.1, let me just find where we are here. And I believe we do in fact have a motion that's been moved by Stuart Kidd and has been seconded by Gary Gunter. Whereas the Ontario Nurses Association own a collective agreement and the Ontario Public Services Employee Union's OPSU collective agreement expires on March 31st, 2022. Now, therefore, be it resolved that on the recommendation of the Personnel Policy, Labor Employee Relations Committee, the Board of Health for the North Bay Parry Sound District Health Unit appoint Nancy Jacko and Scott Robertson as backup if needed as Board of Health representatives on the North Bay Parry Sound District Health Unit Negotiating Committee for 2022. And further be it resolved that the recommendation of the Personnel Policy, Labor, Employee Relations Committee, the Board of Health approve remuneration for this activity in accordance with the Board of Health Policy BF004, Remuneration Board of Health Members. Is there any discussion on this? We did speak about it in the last meeting, portion of the meeting. If there's no discussion, we'll call the vote. Dean?
Approve, and thank you for stepping forward.
Oh, thank you. Dave?
Yes.
Blair?
Yes.
Gary?
Yes.
Nancy, yes. Stuart?
Yes.
Jamie?
Yes.
Scott?
Yes.
Dan?
Yes.
Marianne?
Yes, thank you too, for both of you.
Thank you. With that, it's carried. Okay. Correspondence, we had a list of that included in your package, that you could take a look at. What I was wondering is that I guess our letter didn't make it, right, into that list of correspondence that we sent out. Probably will be in the next, on the alpha list, or was it there? Oh, there you go. I guess I didn't see it. I was thinking it wasn't there, but yes, it did make it. Thank you. The letter that we sent out from our board. Under 10, new business. Thank you very much for allowing me to participate in the Alpha Fall Symposium. And I just sent out an update today, and I apologize for it just going out today. But I had so many notes from that particular session that I had to kind of pare it down to get the salient issues. But if you have any questions at all regarding what I wrote in there, and it's only really hitting the top, please feel free to approach me. And I'm waiting. There are some wonderful slides that were done with the presentations. And I'm just as soon as they do come up on the Alpha website, I'll inform you. So, because I think you might be very interested in some of the information that was there. Okay. I guess we have 11.0 in camera. I guess I should say a couple things before we go there. The big thing from the symposium that you're going to see is the fact that everybody that was there brought up how, and this is not something that's new to us, how in fact the equity was really came up in our community equity and our population equity, how so many people were disadvantaged, and it came up in the way of groups that could not access vaccination, to homelessness, to drug incidents, mental health, and it just really uncovered many of the things that we knew existed all along. And one of the things that came out of that is a lot of work to even vaccinate people and get information out was done very well through public health through this whole process. And can we apply some of those things that we learned to other issues that we have to deal with? And also how public health worked with local government and community partners and everyone to ensure that they were able to deal with this whole pandemic issue. And there were just numerous, really some good things that that came out of the discussions. And the big thing too that was said was be sure that funding isn't cut, and that's looking like it might not be for 2022. The other thing that they said is acute care will probably get additional funding to catch up. What about public health, who has had to carry the brunt of all of this and yet put all of their other programs on the back burner? So make sure that they are given the appropriate resources and time to catch up on the work that was left behind with them doing all of this work in the pandemic. So those are just some of the key things that I could read up. I think, Delegate Chair, you were probably online. Was there anything that had come up that I missed that?
No, I think you've summarized it very well, Nancy. Thank you.
Okay. All right, then I don't think we have anything for number 11 on our agenda in camera. So with that, unless anyone has anything else, we're prepared for our adjournment, number 12, our adjournment, and we don't need a motion for this. And I think we do have our media here.
Hi, Nancy, Madam Chair.
Yes.
It's Dean. Just before we leave, obviously, I'd be remiss not to, again, thank Dr. Chirko. You know, this guy's gone to bat not only for my little town, but our region. We all know it's been very difficult on Dr. Chirko and his family through, social media and everything that's taken place. But he has definitely demonstrated his leadership. And you know what? I would go to war anytime with that guy, even though he's just a small little man. So again, Dr. Chirko, thank you so much for what you do, and continued success. And from the town of Mattawa and the other municipalities I represent, you are a true leader, my friend.
Thank you so much for the kind words, and I'll certainly pass it on to the staff who share in any accolades that I might get. So thank you.
Absolutely, sir. That's what a leader does.
And results, obviously, how we've done speak tons, and so how this district has done and done well all the way across the board with outbreaks and management of them and vaccination rates and the things that have happened. So I think that's an important indicator that just shows your leadership and the team that you have with you, that you select and work with. And so thank you very much. All right, so we're adjourned.
Thanks, Nancy.
Thank you.
Thank you.
Merry Christmas.
Merry Christmas,
Have a great
everybody.
holiday.
Stay well.
Thank you. So we can We do have two media inquiries. They're both from PJ Wilson. So the first is, with the looking of the COVID-19 vaccine will soon be available for the 5 to 11 age group, how will the health unit prepare for this?
Feedback there.
We're getting a lot of feedback.
There.
Okay.
Here.
Okay.
Would you like me to try to read it again?
No, I read it.
Okay.
Thanks. As far as the 5 to 11-year-olds, we've been working on this for quite some time, for over a month or more, once we knew that it was coming. And it took a tremendous effort from so many different areas within the health unit and outside of the health unit. So it's hard to find a place where to start, but we've been planning as far as how best to approach it, communications. We're working with school boards. We're getting venues. We looked at statistics as far as where the groups of these eligible kids were, how to best approach it. We looked at potential uptake. We had all of our departments really involved in the planning phases of it. As I mentioned before, we reached out to community partners to have primary healthcare providers, pharmacies. We have worked with municipalities to get venues. We had to find certainly human resources for immunization, how to make it kid-friendly, what sites were best suited for the kids. Work with One Kids Place in both North Bay, Parry Sound, all of those things, and that people really don't see happening have been ongoing for quite some time. And it's been a tremendous effort from so many, and we're just very, very grateful to have the opportunity now that we've got the vaccine. And certainly I applaud the provincial government for the rollout of it. As soon as they got it, it was in our hands. So they've done a tremendous job to do that, and allocating it throughout the province. So we're going to be starting, we got it today, we're starting it tomorrow, and it'll increase as we go along. So I hope that answers your question.
I think so. So our next question is also from PJ Wilson. I keep seeing stats from the anti-vax folks touting the survival rate of COVID-19, but there never is any mention of the long-term effects. How widespread are these long-term effects, and particularly how many long haulers are there in our region?
That's a very good question, PJ, and thank you for that. What I can start off by saying is that there is more unknown about long-haul syndrome than there is known about it, and it's in evolution. It's being studied. There are so many different studies and so many variables to consider. They don't even have a confirmed definition yet on it, and you'll hear even different names associated with the long haul or post-acute COVID. So it's difficult really to know what the prevalence is, depending on what study that you actually look at, and there are many of them. It can vary anywhere from 30 to 50% of those that have COVID will have at least one symptom 28 days or after the acute phase. So, and as time goes on, that will decrease over time. So there are a lot of variables with it. Now, as far as estimating, so how common is it? Well, the other thing too is that not everybody will report their symptoms that they have. So that's a factor involved with it. Locally and within our region, we don't have any access to that information because it isn't collected public health does not have the access to it. There would have to be a specific study to be done within a region, and we simply don't have the resources to undertake that, especially with the limited capacity that we have to do it at this time. It's something that is being studied, but not with our local public health unit and not within our region.
Thank you. So that completes our media questions. Thank you.